When it comes to bones and muscles, a child isn't as strong as an adult, and sometimes simple horseplay can lead to great pain. It is the case with Nursemaid's elbow, but it is also an injury that's easy to prevent.
Swinging is one of the joys of childhood, but when it comes to swinging a child by the arms, be careful.
Relatively common injury in younger kids.
The common injury is known as nursemaid's elbow.
Most common in kids between the ages of about 1 and 3.
Dr. Brian Kelly of St. Louis Children's Hospital explains.
With a traction force on the arm, in a child it allows these bones to separate, and this annular ligament can become infolded in between the two bones. And that ligament there will cause pain with motion.
Nursemaid's elbow can be the result of a number of movements: pulling a child by the arm, jerking a child's arm, swinging them by the arm. But while it is painful, there isn't necessarily a need for panic.
Is there a fear of any type of long-term issue?
No, for this, no.
There are signs to differentiate between this injury and something more serious.
Typically is not associated with any bruising, swelling, deformity, redness. It's really just pain.
Treating nursemaid's elbow is not a complicated procedure for a doctor.
The most common is you turn the palm up and flex the arm up, and that's enough to separate the bones and let that ligament pop back into place. It's not infrequent that just a couple of minutes later the kid is using the arm normally without any pain.
The best way to prevent it is to use caution when lifting a child by their limbs.
Trying to avoid some of those activities where you're swinging the kids around, that's one thing you can do to prevent.
Now, while the procedure to fix nursemaid's elbow is simple, Dr. Kelly does recommend that parents see a doctor to treat that injury. And I'll just say this, as a parent, when I was first out with my first child, swung him around by the arms, it popped out, and he screamed and you don't know what to do. He couldn't move his arm or anything. You go to the hospital and they're like, oh, we know what this is. Whoop. And he was good to go again. So, you don't need to be alarmed, yet at the same time, you got to make sure it's not a fracture or something like that. That's why you want to take the child to the doctor and have him looked out properly.
Have the professionals handle it,
There
right?
you go.
Rennie, thank you. Okay.